This is one of the series of programs, e-seminars that the Embassy of Vietnam is organizing in India under Indo-Vietnam Business Forum, exploring Vietnam's incredible growth in pharma. Now, the purpose of this webinar is business networking between pharma players between India and Vietnam, building synergy between organizations of both countries, understand the opportunities that Vietnam provides to our country, India and Indian players, and finally exploring collaborations in both front, primarily in the trade and investment. How do we increase trade between, thank you so much Aparajita ma'am for joining us. If you can place your mobile vertically, it will be great. I think the view would be better. So in both front, trade and investment, let me give a quick intro. Before that, some basic instructions for all our respected participants from India and Vietnam. Kindly keep yourself in mute mode unless you are speaking, so that it does not disturb the flow of the content and seminar. If you have any questions or if you want to share any your profile or your contact details, kindly do so in the chat box. You can continue your discussion in the chat box. We will while moderating the program, I will pick your questions from the chat and we will take it to the panel. So we will discuss like that. We are also running this program live in our Facebook and YouTube channel, where you can watch this program also live later. So for that, if you can subscribe to our YouTube and Facebook page, the Policy Times YouTube and Facebook page, you can watch it there. We are also sharing the same in our Embassy web Facebook page. So you can also watch us in the Embassy Facebook page. I really want to welcome Professor Lee Viet Zung. Thank you so much for joining us, sir. So wonderful to have you, Deputy Director of the Drug Administration in the Ministry of Health. So we have representatives from the embassy, from the ministry, and we have a young and dynamic leader, Mr. Pham Hong Chang, Investment Advisor of Vietnam, will be joining us soon. A quick intro about Vietnam, then I'll start the program. Vietnam is an unparalleled country, rising, emerging in this belt of Asia, especially in the Southeast Asia. Vietnam has introduced Doi Moi reform in 1980s, 86 to be precise. Since then, the political and economic reform, which is very popularly known as Doi Moi reform, the country has seen exponential growth, and it has emerged as one of the middle income countries from being one of the poorest countries of Asia. Between 2002 and 2018, the per capita income of the country has so it has reached to almost 2,700 US dollar, almost 3 times of the initial figure. So I will request all, kindly keep yourself in mute mode. Please do not unmute unless you will be requested to unmute yourself. So the poverty, one of the massive successes of the country, Vietnam, is that Vietnam has been able to reduce its poverty rate from 70% to just 6%. And that too on a criteria of $3.2 per day, which is way above the criteria set by United Nations World Health Organization or World Bank. So even at this troublesome time, the Vietnam economy is growing at a rate of 3 to 4%, which is unprecedented when most of the, I think 90% countries of the 180 countries are witnessing a negative growth. Vietnam is the only country which would be growing at 3 to 4%. Vietnam is one of the also ranks in 48th out of 157 in the Human Capital Index, giving an indication that it has one of the most low cost and skilled manpower that any country can provide. It has almost 100 million population, where a large section, 70% of the population is under the 35 years of age, means working age. The final point about Vietnam, when Ruchir Sharma, one of the modern thinkers, a very famous, renowned thinker, he coined Vietnam as Asia's next miracle. So Japan was the first miracle which witnessed massive industrial growth. Taiwan was the second. South Korea was the third. Recently, China has shown to the world of what is the modern industrialization is and possible. Next is going to be Vietnam. Now, I will not go into the deep of this sector because I would request our speakers to talk, and you all are expert on the Vietnam sector. But pharma sector in Vietnam now is touching, by 2020 it will touch $8 billion, giving a huge leverage for countries like ours, and growing at a CAGR of more than 15.4%, which is again a huge uh, number. Now, Vietnam's one of the phenomena that is emerging by 2015, almost 33% population are living in cities. Now that urbanization, or people residing in urban area, is going to increase to 40% by 2020 now, and it will touch almost 50% by 2030. More importantly, the aged population in the country, older than 65 years of age, is also going to triple, making it almost 18.4 million, which is 17%, which also gives a reflection of higher per capita in expenditure of pharma, or in the pharma, because per capita spending in the pharma in Vietnam is $37.97. It was in 2015, has gone up to $85 in 2020. I have a lot of facts and figures, but I will repeat and share all of them in between. Now, as I say, that this is just a program where we will understand the potential, the opportunity of the country Vietnam in India. I would like to invite, as a beginner, I would like to invite and request Excellency Ambassador Pham Sam Chow to kindly come on and address our August gathering today. Excellency is a diplomat, educator, diverse experience in international experience in multilateral affairs, cultural diplomacy, education, and all. And he was Secretary General of Vietnam National Commission at UNESCO. He led the country Vietnam in different international fora, especially at UNESCO. He was appointed as Vietnam's youngest ambassador and permanent delegate of Vietnam to UNESCO. He was also ambassador to Luxembourg, Belgium, and European Commission, where he played an exemplary role uh, in negotiations between European Union and Vietnam to develop EU-Vietnam Free Trade Agreement, followed by EU-Vietnam Dialogue on Human Rights. He led Vietnam into many international programs. So with this, and from my personal experience, I got connected with the Excellency almost 2 years ago, and he is one of the most dynamic, most energetic, and most active ambassador or diplomats that I have ever seen in India. So with this, may I request Excellency to kindly deliver the welcome remarks and your keynote speech. Oh, so with this, may I request Excellency to kindly deliver a welcome remarks and your introductory speech. Hello?
Hello, am I audible?
Yeah, you are audible, Excellency. I think someone has the access of this program and trying to mute. So automatically the program is getting muted. Okay, Excellency, you can go on, please.
Namaste. Thank you very much, Akram Hok and the Policy Time for working closely with the Embassy of Vietnam in order to make this event possible. I also would like to acknowledge the presence of Professor Dr. Lê Việt Dũng, Deputy Director of the Drug Administration Health of the Government of Vietnam. And I also would like to thank Dr. Viranchi Shah, Vice President of Indian Drug Manufacturer Association. and different business people in the area of pharmaceutical sector. This is the 7th webinar in a series of 10 webinars organized by the Embassy of Vietnam in association with the Policy Time in the context of the Indo-Vietnam Business Forum 2020 in order to bring together the business people of the two countries in various sectors. So I'm very much grateful for your presence today in order to get a better understanding of the pharma sector and the possibility for the cooperation between our two business people on the two sides. I just want to share with you a number of remarks in the area of pharma and its cooperation potential between our two countries. For Vietnam, this is a very important sector because number one, the interest by the Vietnamese people on pharma is increasing substantially over the past few years. More and more people concerned about their health situation to know more about different products that make them young again and keep them fit. So that is the first important thing. Number two, their GDP per capita in Vietnam is increasing at the moment, and that allowed the people to spend more on healthcare and their wellness. And number three, according to the recent survey conducted by IBM, the pharma market of Vietnam will reach 7.7 billion US dollar by 2021 and will reach 16.1 billion US dollars by 2026. So on the average, spending per capita in Vietnam for pharmaceutical product will reach 14% of the total expenditure per capita. So this is a very important market. And at the moment, domestic manufacturing can only meet 50% of the demand. The balance we need to import from outside. When it comes to domestic production, according to our statistics, we between 80 and 90% from outside. And our major suppliers of the input for pharmaceutical production comes from India and China. Therefore, over the past 10 years, constitute one of the top 10 products that we trade between India and Vietnam. And on the average, it's between 200 and 400 million US dollars per year. And at the moment, we have the presence of more than 300 pharmaceutical companies of India in Vietnam, among which we have major companies like Sun Pharma, Natco, Milan, Glenmark, etc. In terms of the government policy, the Vietnamese people have been, government have been accommodating to various requests put forward by the Indian government. We have changed the circular in order to allow Indian pharma company to be able to produce their products in Vietnam, but also to be recognized as Group 1 when we talk about their recognition by EU and US. And but also at this opportunity, on this occasion, I also want to mention that some of the Indian company could not make their product as their pledge. Therefore, between 40 and 50 pharmaceutical of Indian company have been placed in the blacklist in Vietnam because of their poor considerations. If you cannot trade high quality product, then be listed in the blacklist. I hope that Professor Zoom will be able to speak more on that matter and adjusted its policy, especially changed circular in order to allow Indian farmers to participate in the public bidding to provide pharmaceutical and drugs for different public healthcare facilities. So this is a big development and in our cooperation. At the next stage, many Indian companies will be able to participate in the public tender and will be treated on the same footing as the European companies when they are to produce high quality product. So those are some observations I want to share with you, and I hope that this webinar will be a platform for Indian pharmaceutical company to interact with the drug administration of Vietnam and to make matchmaking with a Vietnamese pharmaceutical company. With that, I thank you very much indeed, and I wish webinar a great success. Thank you very much, Mr. Akra Hok.
Thank you so much, Excellency, for the short introduction and welcome remarks. May I now request Professor Le Viet Zoom, who is the Deputy Director of the Drug Administration, Ministry of Health, Government of Vietnam, to kindly deliver your special address.
Good afternoon, everybody. Thank you very much, Mr. Akram Hok, for your introduction. And also, I would like to thank the Ambassador of Vietnam to India, Mr. Phạm Sanh Châu. So now come to the meeting. There's some my colleagues and enjoy meeting with you. To start, I would like to introduce some potentials of Vietnam pharmaceutical market to share. And the size of pharmaceutical market in Vietnam currently meets the needs of 100 million people. The medicine consumption value per capita is about $64. The total medicine consumption value is expected to be $6.23 billion by 2020. This statistic a little bit different from the previous statistic from Mr. Cho. However, you know, of the 6.23 billion of the value of the local production is estimated to be about 2.9 billion US dollar, and the value of imported medicine is about 3.5 billion US dollar. And the value of imported starting materials is estimated at about 850 million US dollar each year. The production and as a business network is widespread, with about 250 manufacturing plants and about 200 import-export establishments, 4,300 wholesalers, and over 62,000 retailers in Vietnam. However, the development of the Vietnam pharmaceutical sector in recent years has not met the expectation of the government and that are commensurate with the current potential of Vietnam. Uh, it embraces advantages in terms of human resources, the variety of medicinal herbs, the preferences, policies, and explicit goals that are clearly stated in the pharmaceutical law and various resolutions of the party and the government. For example, for foreign investors in the Article 7 of the pharmaceutical law states the following objectives I'd like to share with you. The incentives should be provided to investment in production of medicines, starting materials, essential medicines, medicines for prevention and control of social diseases, vaccines, biologics, herbal medicines, traditional medicines, and orphan medicines. Incentives should also be given to the scientific research on pharmacological technology and biotechnology for production of new medicines. Also, favorable conditions shall be facilitated in terms of procedures for submission of registration, a potential of patent generics, and first-line biosimilars. Priority is also given in terms of procedures for registration of medicines for marketing and licensing of WHO pre-qualified orphan medicines and vaccines import. Combination of the state budget investment with the mobilization of other resources shall be made for the development of the production of vaccines, biologics, herbal medicines, traditional medicine, potential of patents, medicines, cultivation and productions of medicinal herbs, discovering, conserving, and applying science and technology in research and development of precious, rare, endemic medicinal herbs. The government also encouraged the technology transfer in medicine production, developing the network of medicine circulation, distribution, pharmacy chains, storage, and supply of medicines in a professional, modern, and efficient manner to ensure timely, adequate supply of quality medicines. Meeting the people needs, encouraging pharmacies, medicine stores to operate 24 hours. The party and the government always direct the health sector with specific goals and plans. The pharmaceutical sector development policy is mentioned at the resolution number 20 NQ TW dated October 25th of 2017 of the 6th session of the 12th Central Party Committee on Strengthening the Protection, Care and Promotion of the People's Health in New Contexts. Also, the resolution number 139 dated from the government dated this on December 31st of 2017 of the government promulgating the government's action program to implement resolution of number 20 above. And also that's regarding the investment incentives, I would like to introduce some some law, the government to support some government law to support the investor. For example, the resolution 50 dated 2019 on the orientation of refining institutions and policies, increasing quality and effectiveness of foreign investment cooperation by 2030. Also, this resolution number 52 dated 2019 of the principle on the number of introduction and policies on active engagement in the fourth industrial revolution. The Ministry of Health is reporting to the government for the approval of the pharmaceutical industry development project up to 2030 and the vision 2045. Its specific contents related to policy on investment in the pharmaceutical sectors. So we also target by 2025, at least 2 high-tech pharmaceutical industrial parks will have been set up for the production of innovator medicines, specialized medicines, generics of high-tech dosage form, and Vietnam branded herbal medicine, high-value vaccine, biologics. The 2 industrial parks we intend to establish in Quang Ninh province and Ho Chi Minh City. By 2030, Vietnam will become a regional hub for innovator medicines. The technology of at least 100 innovator medicine will be transferred and manufactured in Vietnam. So we prioritize, the priorities will be given to patent medicine, multivalent vaccines, therapeutic biologics, biosimilar products of high economic values that Vietnam cannot produce yet. So the export value of domestically produced medicine is expected to reach $1 billion by 2030. And the government also gives some key solutions to foreign investors. The first one is the enterprises. We support enterprises producing patent medicine. So those companies will enjoy the same incentives as high-tech enterprises. Also, the invented medicine, generics, medicine in modern dosage form, and multivalent vaccine are considered high-tech products. The incentives in terms of tax, credit, land use policy. For example, land rental price, land leasing term will also be given to enterprises or entities investing in developing herbal medicine, herbal materials. Review and supplement will be made to the list of high-tech products for products regarding medicine in advanced dosage form, lyophilized tablets, controlled release tablets, target acting medicines, lead-dose form, hard capsule, or vaccines, or biologics, or starting material of biological origin, herbal medicine produced from standardized substances, combinations, or domestically produced medicines that do not meet a requirement in terms of treatment needs, prices, and supply capacity. So promoting the mobilization of local and foreign organizations and individuals to invest in the development of local medicine production, medicine tools manufacture, and transfer technology of vaccine and biologics. priorities also will also be given to the development of projects of medicine technology transfer to manufacture of patient medicine. So those are some law I'd like to introduce to you. So Vietnamese government encourage the foreign investor in Vietnam currently. So thank you very much, and I also with the business forum, the Indo-Vietnam Business Forum success. Thank you.
Thank you so much, sir. Wonderful to hear you for the comprehensive presentation and all the statistics and facts and the policies that government has adopted for sharing. And kindly be with us. We will open for a discussion in the end after all our speakers spoken, so that some of their queries or questions we can address. Just 2-3 facts that for our Indian companies joining us here. India is more known as the pharma capital of the world, and Indian pharma community is extremely successful in US. US is India's one of the largest markets, followed by other markets. So 90%, now just for the Indian perspective, for Vietnam, 90% of the drugs, as I find from research, drug materials, Vietnam imports from foreign countries, which means, and this in terms of number, it reaches to $2.1 billion that in 2017, that was the figure. So which means that Vietnam is one of the also big markets for Indian players to explore. Also in 2009, Vietnamese government has introduced new health insurance law for universal coverage by 2020. And it has also taken a lot of legal requirements in terms of pharma production in the country, which means that if the companies have good manufacturing practices, Vietnam can be one of the prominent destinations for Indian manufacturers, because the labor is very cheap. The context is that many pharma players remains undeveloped in Vietnam. A lot of local companies are looking forward for international partners. On the other hand, the international partners are looking at Vietnam for low cost manufacturing because of the reasonably cheaper labor in the sector. So these are the complementary relationship that we have between India and Vietnam that we can explore. So with this address, we go to the next session, sectoral session, where we will try to explore opportunities. We will hear the Indian pharma leaders' voice on what they feel, and we have diverse sectors leaders from joining. So trade and investment opportunities in pharma between India and Vietnam. And the first leader that we have, Dr. Viranchi Shah, who is a senior vice president, Indian Drug Manufacturers Association. He's a very veteran figure in the pharma industry, having deep experience in international trade and export. So requesting Dr. Shah to kindly deliver your remarks, sir.
Thank you, Mr. Akram. His Excellency Ambassador Pham San Chau, a very dynamic leader from the Embassy of Vietnam in India. Very respected Professor Dr. Le Viet Zoom, a Deputy Director of the DAV, Ministry of Health, Vietnam. Mr. Pham Hong Ngoc Chan, the investment advisor for the Vietnamese investment. Mr. Bui Chung Pyong, the head of the trade section of the Embassy of Vietnam. Leaders from the Indian side, Dr. Parajita Takiar from the FOB, Dr. Ravi Uday Bhaskar from Pharmaceuticals, Mr. Murli from Pharmaceuticals, and Mr. Akram Haq from the Policy Times, and Mr. Pratap Chauhan from the Jiva Life Sciences. A very good afternoon to all. It has been an excellent experience for me to understand these various aspects of the growth of Vietnam. And honestly, I've been traveling Vietnam very often, and I have seen the transformation of Vietnam in the last 10-15 years. And Vietnam has in fact set an example for all of us to understand how a government and how the the regulators there could maneuver such a massive transformation of economy. And Vietnam deserves compliments for this wonderful success in in transforming their economy. Uh, Friends, IDMA is India's largest association of pharmaceutical manufacturers, and we are spread across the length and breadth of the company. We represent the voice of pharmaceutical industry in India, representing the interest of the small, medium, and large pharmaceutical companies that are into both domestic and international stage phases. We represent industries from the bulk drug or the API industry, as well as in the formulation industry and other allied sectors that help India become what it is, the pharmacy of the world. We participate regularly with the government and regulatory bodies in their committees, in helping them in policy making, in playing a facilitative role to take up the issues of the industries to various government and semi-government sectors, to make sure that whatever deficiencies or inconsistencies are there could be brought up to the regulatory authorities and they could be ironed out so that the industry can grow and progress. And in this line, I think this meeting becomes very much important, looking to the great potential of business that can happen between India and Vietnam. Sir, you must be knowing India is the third largest producer of pharmaceuticals in the world. And we have largest number of US FDA approved plants outside US in the world, which is in excess of some 650. We also have the largest number of EU GMP certified plants in the world outside US, which is again in almost 700 EU GMP certified units in India. And almost 55% of our exports happens to the regulated world. We are also the largest supplier to the United Nations and to the World Health Organization, and we proudly have established ourselves as a pharmacy of the world. And the Indian pharmaceutical industry and IDMA have been playing very constructive role in this journey of India. Sir, I got to know that the overall imports of Vietnam is about 2.1 billion US dollars per year per annum in pharmaceuticals, while the statistics of the Indian exports is something around 220, 230 million US dollars for exports of this sector from India to Vietnam. So to say that we contribute currently about 10% in value of the Vietnamese imports of medicines. And sir, when Modi ji came to power, I think one of the first steps, one of the first policies he procrastinated was about looking east. And when we look east from India, sir, Vietnam is a very important destination for integration between the Indian and the Vietnamese companies, especially in the pharma and trade sector. Sir, I want to highlight that there are a lot of underutilized potential in the India-Vietnam trade. And if we take things in a very systematic manner, the day could not be too far when the contribution of India could rise from 10% to 20%, even up to 50%, because we have that capability, especially in times of COVID, when our entire global supply chain was crumbled. India was one country that stood up and supplied all the essential medicines almost to the entire globe, to the extent that at that point in time, medicines like azithromycin, hydroxychloroquine were in very short supply, but the Indian industry and the government worked very closely, and we supplied medicines to almost every country that needed these medicines in the time of crisis. So, sir, we are a very credible manufacturer. We are a very credible supply chain member. Of course, there are issues that need to be understood, and these issues need not happen. It couldn't be solved on a table discussion. I believe that we need to do much more beyond that. And one of the suggestions I have is making a working group kind of a committee where we have representations from the Indian trade and industry associations. We can have representations from the central CDSCO or some key state regulators from the Indian side. And we can also have representations from the Vietnamese government and Vietnamese Chamber of Commerce who want to participate. And taking this kind of a forum, on a long term, in a year, 2 years, 3 years, if we can build trust, if we can identify the areas where we can work closely in the benefit of both the nations, I think there is a big opportunity there, both for the Vietnam side and probably our mutual business, our one-to-one business can multiply in the years to come. So it is my earnest request to the ambassador and to Dr. Viet from the DAV to please look into this, if we can form some sort of a committee where we can address the issues where the industry from India and the regulators and the industry from Vietnam can talk. Sir, there were certain suggestions I had with respect to the time of registrations and certain renewal issues, but these I think are very small issues, and if we set up a working committee, we can address many of them. As IDMA, we will also like to follow up this meeting with some of the critical issues, which, if addressed from both the sides, there is an ample opportunity of streamlining a lot of things and improving the business, especially in the pharmaceutical sector between Vietnam and India. So with these words, sir, let me assure you that on the side of IDMA, we will do our best to make sure that we cooperate and we talk regularly with the authorities in Vietnam and with the authorities in India to make sure that the trade and business between India and Vietnam can multiply in the years to come. Thank you, Mr. Akram, once again for having IDMA on this platform, and I can assure you that we'll be playing a very constructive role to take these discussions forward. Thank you.
Thank you so much, Dr. Shah. Wonderful for your support and help and collaboration that you have given since the beginning to organize this and making it a good success, and for also requesting our members to join for this important program. I now go to our next speaker, one of the, again, dynamic personalities from a little different field from the mainstream, Dr. Pratap Chauhan, who is a director of Jiva Ayurveda. So he has been healing people in India and across Europe and other parts of the world through his magical, advice and treatment through Ayurveda, Unani, and different branch of medicines that he will share in more details. And I believe that Indian healthcare has a lot to offer to the global market because, as I said in the beginning also, that India is such a country where homeopathy is as much a success like Ayurveda and as much a success like allopathy. So India is the only country, I think, which can give a comprehensive or a strategy for a holistic or comprehensive healthcare system where prevention is better than cure philosophy can be adopted, and more prevention initiatives can be taken in terms of immunity. So the world is suffering from COVID crisis, and you all know the facts and data, though the actual number is much more different from the numbers that we have in front of us, but at least in terms of the fatality rate, India has done outstandingly well to save lives, because Indians are built with a different kind of immunity system where Ayurveda, homeopathy, this kind of things have given a huge mileage to boost our immunity. And to talk on that, and India again can offer a lot to Vietnam, because Vietnam has deep connection with India through Buddhism, and which also connects with our culture, Indian culture. I think this is one area where I also wanted to have some highlights. So with this, may I request Dr. Pratap Chauhan to kindly deliver your speech.
Thank you, Akram, for the introduction. And first of all, I would like to thank you for inviting me here. And I'm very honored to be a part of this very esteemed, gathering here. As you said, I'm a little bit out of the track, but as you will all realize that Ayurveda is going to become, somewhere in the mainstream, if not play the main role, I'm saying that it will definitely play a very major role. This we have all seen during this crisis, during the pandemic. So first of all, I would like to just mention a little bit about what we do and how we can maybe collaborate with Vietnam. So His Excellency Honorable Ambassador Pham Chau Ji and Professor Lee Dang Ji, thank you very much for listening to this small presentation that I'm going to give. Jiva Ayurveda is one of the leading Ayurveda companies in India. We have a network of around 80 clinics, and we also run the world's largest Ayurvedic telemedicine facility, where we have around 350 Ayurvedic doctors. In addition, we have some support staff. So total around 500 people are working, and we are doing every day around 8,000 consultations, which are like one of the, like you can say, one of the largest number of consultations in a single day. We were even just published in an India Book of Records also for this. So I think what I will do is that I will want to show you a small presentation. If I can share my screen, I think it's so this is I'm just showing you this picture. This is what is called Jivagram. It's a center for well-being, we call it, but it has been accredited as a Ayush hospital also. And I am very happy to share this with you that already people from Vietnam have visited this place, and there are people who has come as patients to get treatment. And also recently we had some kind of a MOU with one traditional medicine hospital also from Vietnam, and some doctors, around 30 doctors came, and they were very much deeply interested, and we're going to work with them on like lifestyle diseases, because Ayurveda has a very good chance to offer something in lifestyle diseases which are caused by wrong lifestyle. So diseases like diabetes and obesity, and these days all these hyperlipidemia, high cholesterol, heart disease. And in fact, there is so much going on during this pandemic with the mind. So many mental problems. So mental well-being and lifestyle diseases is something where Ayurveda plays a very important role. So this facility is located just outside of Delhi. I would like to invite His Excellency Ambassador, maybe with your wife, please come and stay with us for a weekend and experience some wonderful Ayurvedic treatments. So I'll be honored to have you as my guest there. So Jiva has about 27 years of excellence in practice of Ayurveda. We have been working in India, and not only in India, we have Ayurveda schools in Japan, in France, in Poland, Lithuania, and we are also giving lectures in around 35 countries of the world, where we go and educate about lifestyle, what is Ayurveda, how people can adopt simple things in their daily life, what things are available in their kitchen. And the second part is, if there are serious patients, patients who are called incurable, patients who cannot be treated with like modern medicines even, or they have to take medicines all their life, those type of patients, we invite them to our center here, and patients come from all over the world. But what I'm interested is, I'm very happy to share this knowledge with Vietnam. So because Vietnam also has a history of traditional medicine, they have their own traditional medicine. So we will be very keen to collaborate through government or through some private companies or private hospitals, and we would like to share. We have a database of around 2 million patients now, and we have published the world's largest Ayurvedic big data analysis first time in 2018. So we have protocols for every disease, and these can be replicated. I'm not talking that this knowledge is only with me. I have a team of 350 Ayurvedic doctors, and all the protocols are replicable. So through the government dialogue and through the dialogue with your doctors and through your hospitals, we will be very happy to share this knowledge and also get knowledge from Vietnam. If there are certain things there which are very effective in traditional medicine field, we will be happy to take them and also implement them in our hospital here, of what we call the Center for Wellbeing. Jiva works in 3 areas: education, Ayurveda, and culture. In education, we have a very nice school where we are teaching children from very early age. The problem with today's education is that we learn many things: physics, chemistry, mathematics, then we go to the university, we get an MBA degree, we become doctors and engineers, but we don't know how to be happy. Nobody teaches us how to deal with emotional problems. Nobody teaches us how to make harmonious relations. So we have created a course also for schools. If you are interested, we can implement this course. So the program is called Ayur School, and we have a course for also for universities. So anybody who want to like get into this area, these are simple basic things about eating, about knowing your constitution, eating according to your constitution, lifestyle, and this is a big problem in the world, and specifically the mind area. Ayurveda talks a lot about what is mind, how to keep the mind healthy and happy. So this is what we do in Jiva. Of course, these are the founder members. This is not very, we have a very young team also. There's a team of young leaders, you can see, and they're all very dedicated and very much, interested in bringing this knowledge to the world. So we have a Jiva Medical and Research Center. This is called the Jiva MRC. As I mentioned, this is the world's largest Ayurvedic telemedicine facility. And people from all over the world can do consultations through video, through audio. Even in India, in the remote villages, we can offer services, clinical consultations, and if they want medicines, we send by post. We also have a network of 80 clinics in 9 states and with Panchkarma facilities in these states. So I'm just showing you, there are products which are called rejuvenative products, or products that are used for prevention. As Mr. Akram mentioned, especially in pandemic, this have been proved now that Ayurveda has played a very important role, not only in preventing, but also in treatment of COVID patients. Many of you maybe are not aware, but in India, along with the Ministry of Ayush and also with the modern medical, departments like CSIR, ICMR, Ayurvedic trials have been going on in at least 60 locations in India. And these are on the patients who are positive patients. And amazing results have come out. I don't have time to share with you all these results, but both for prevention as well as for treatment, they have seen wonderful results. And this, I think there's not much to be surprised about, because China has already done it. In China, they had given herbal medicines to almost 90% of the COVID positive patients. So we have many such products. We have quite good of oils for joint pain, cosmetics, and some teas, herbal teas. This is another area where we would like to collaborate. If some companies are interested to import these products, we will be very happy to collaborate with them. We have international training programs where students come here or our teachers go there, and we organize certificate courses for medical professionals, for students, for general people, for even for the corporate people. We have a program called Ayur Corp. Stress is the biggest killer in the world today, and people, they're actually already going into this direction where they want to, manage the stress through yoga, through breathing, through traditional styles, music. In our Jivagram, we also have all these different types of things that we do. Medical innovation and technology, we have a lot of technological interventions that we have created in our practice. Jiva app is one of them. Then protocols and consultation software is there. So this is first time we have done in Ayurveda. No company in India has ever done so much technological intervention. I even was the first one to start a website in 1995. So I'm just quickly.
Thank you, Uncle. Yeah, if you can conclude in 1 minute.
Video consultation is there, and then we have also a factory which is fully, HACCP, WHO GMP certified factory, which manufactures more than 700 different types of products. So this is another area, a lot of awards and recognition. That's not very interesting. Big data analysis that I was mentioning, we have published. And in Jivagram, this is what we do. There are some certain things I want to just share with you. We treat all these diseases, whether it is cervical or back pain, de-stress, detoxification, diabetic neuropathy, diabetic nephropathy, hair fall, infertility, long list of diseases for which we have successful treatments and this all treatment is Ayurvedic natural. So we give personalized treatment to people, root cause based approach as Ayurveda says, and everybody is considered as a unique patient. So this is what some pictures from there. There is a threefold Jiva healing program, which is physical, mental, and spiritual, or all three levels. So this is a complete holistic approach. And then there are detoxification and rejuvenative programs. There is yoga classes. There is a naturopathy center we also have in Jiva. We also have a Jiva organic farm where we grow our own vegetables. We have our own cows to get the milk from there. And of course, meals are very nice, very tasty. Sattvic meals, as we say in Ayurveda. Ayurvedic preparation of food. We also do cooking classes for people. Reflexology is another part of Jivagram. We also have music therapy, where various type of healing sounds are used for healing the patients. We have mudra. This is a part of yoga. Mudra therapy is there. We also have Indian rural cooking, as they used to cook in the rural time. So this is also quite healing, very, very relaxing. It's called like slow cooking, you can say. And then we have also art therapy. You can do art, you can do pottery, and various types of arts. They're available. Meditation center is also there. We can do relaxation and meditation. And this is how you live at Jivagram. There are nice facility. So I would like that, those of you who would be interested in any kind of collaboration, if you want to bring Ayurveda to your hospitals, to your colleges, to your schools, we will be very happy. If you want to create program for corporate people, we will be very happy. And vice versa, if there are patients that you think can come and get treatment in here in our Jivagram, we will be very happy.
Thank you.
To share all that with. Thank you.
Thank you so much, Dr. Pratap Chauhan, for your comprehensive and detailed presentation. I think that there are a lot of areas which can provide healing as well as prevention things in the healthcare system. So now with this, I want to invite our next speaker, also women pharma leader that I am encountered with in this conference. So I want to invite Dr. Aparajita Takia, Senior Vice President of Federation of Pharma Entrepreneurs, FOP in short that we call. Ma'am, over to you.
Good afternoon, everybody. Thanks, Akram, for giving me the opportunity. And I would like to address our Honorable His Excellency, our Ambassador from Vietnam, Phan San Chu. I am really amazed with the clarity of thought that you have, sir. And I'm sure with this kind of clarity of thought, things are really going to go ahead. I would like to thank Professor Lee Wat Dung, Deputy Director of Drug Administration, Ministry of Health. Sir, I would also like to congratulate the drug department from Vietnam, how they have uplifted and upgraded the regulatory level. It's amazing, and it's an example that you have set for other countries to follow. Sir, I represent a group from MSME, and we in India, you can say, are a huge part of the total pharmaceutical industry. And we in India are responsible to quite a lot of extent to give competition to all the major players, because we give the competitive edge by manufacturing quality medicine and being able to manufacture it at a price which we forward it to the consumer. And as a result, India is one of the destinations wherein the best quality medicine at the cheapest prices is available. I would like to just take up a small issue His Excellency had pointed out regarding some issues with products from India. Sir, way back when the export started to Vietnam from India, the regulatory standards were very minimalistic in both the countries, be it Vietnam or India. As a result, the products that were exported, the level was an issue. Eventually, you have very nicely weeded out all such kind of problems. And let me say right now, the regulatory standards of Vietnam is one of the best. But here again, a word of caution. Quality always comes at a price. Like, for example, we go to buy an air conditioner, it has stars. 5-star. So we always see how much electricity cost we are going to save, and according, this is just an example. According to that, we like to buy that thing, because quality has no limit, and we have to define standards wherein we would like it to be inbuilt in our products. Like in India, with the level of quality standard, right now we are around 130 billion people, and India is almost self-sufficient and supplying all the medicines for its people by its own self. It's almost independent. Since it is a webinar for investment, I have some points that I would like to put forward, which would help. And like Mr. Virenchini Shah, Dr. Virenchini Shah suggested, we can form a working committee so that such pointers and interaction can go on, and something substantial can eventually happen. Like obviously, for any kind of a partnership to happen, there has to be a conducive environment. Then we need to find out what are the attractions the investors have in Vietnam, which will encourage them to start investing in Vietnam, because there are a lot many interested people that we found out in our group also and otherwise also. Then what are the cost of land, the power tariff, the type of incentives the government is offering. Then what kind of consortium can be made between Vietnam and smaller countries, such that the volume part of a big unit, which whoever sets it up, is taken care of. What I mean is that there should be there should be capacity to consume if high capacity plants are put up. Then what is the availability of manpower, especially skilled, and what kind of academia collaborations are possible? What kind of research projects are given priority? A few have been mentioned by the Deputy Drug Administration Department Director, and we have noted that out. I will pass it on to our 425 members that we have, so that they have a basic input and further they can interact with you. Then what we are looking for is a single window system, a fast track system, and systemized approval system within time limits, because if after investment there is going to be a lot of time for approvals, then that cost is which becomes very heavy for any kind of venture to be able to be successful, because the purpose is not only putting the plant, the purpose is to successfully run it for years to come. Then what kind of financial institutes can help, like the rate of interest, and are there some companies available for JVs in Vietnam? So if this kind of information is available, kindly share, so that we can at least try to come back to you regarding what all are our possibilities. Thank you so much, sir.
Thank you so much, ma'am, for the wonderful view. With this, if Murari sir is here, or Ravi Uday sir is a little occupied, he is having a conference somewhere. He will also join us soon. So I would request as our next speaker, Murari sir, Director Pharmaceuticals, to also share your views.
Very good afternoon. Thank you for giving this opportunity. Am I audible, Mr. Akram?
Yes, sir, you are very much audible. Yeah,
okay,
please.
Thank you. First of all, I would like to thank you for giving me this opportunity. His Excellency, Mr. Pham San Cho, Deputy Director Lee Viet Tong, Dun, Dr. Aprajita Chakia, Dr. Virenchi Shah, and all other distinguished experts and seniors on board. I would like to give an overview of Pharmaceuticals, as you might be knowing, but for the information of the other participants. Pharmaceutical Export Promotion Council is a body set up by Ministry of Commerce and Industry for promoting the trade of pharmaceuticals and allied products, which includes biotechnology, Ayush products as well, globally. Akram, can I share my screen? I would like to present few slides.
Yes, sir. So if you can make it short and we can go into, sir, a
Yes.
speech would be better if we can finish within speech. But yeah,
Okay, I'll quickly run through this.
yeah.
So is it visible?
Yes, we can see
Okay.
it.
So
Please make it short within 5 minutes so that we can.
Yes.
Discuss.
Like the Dr. Virenchi Shah has already covered most of the things. I would like to touch upon what he has not covered. If you see the credibility of Indian companies and the strengths what Indian companies have, we have about 8 of 20 top global generics by 2008 are from India, and 70% of vaccine requirement are sourced from India through pre-qualification units. And we have during this COVID, we have supplied hydroxychloroquine to about 112 nations. And the growth, if you see April to September, we have grown by 14%. And the credentials what India has itself proves, the exports are to about for 55 countries, 55% are to highly regulated countries. You can clearly see the top exporting partners are importing partners of India, USA, South Africa, and UK. And looking at how we are doing as far as the ASEAN as a whole is concerned, the exports are to the tune of $1,292 million with a group, and during and this the exports to Vietnam, the current slide you can see there is a negative growth of 8.72%. This can be the reasons are many. The reasons are like the difficulties faced by the Indian pharma company with respect to COPP and the inspections and other things. And coming to April to September, yes, we have seen a positive growth which of about 11.66% when compared to previous April to September of 2019. Then these are the top 10 products, what we have been exporting to Vietnam as such. They again, these are formulations. These are bulk drugs, and these are formulations which we are exporting currently to Vietnam. It is a a pride factor that to say that Vietnam is listing among the India is listing among the top 10 formulation importing partners of Vietnam, and we stand at third rank with $264 million. And this is how these are the top 10 products of Vietnam, which India also import from Vietnam. These are the imports which we do it from Vietnam, and in terms of the bulk drugs, chapter 29. Yes, coming to the possible solutions where we can really cooperate with each other are, we have made these suggestions when we visit with the pharmaceutical delegations and meet these DAV officers, as well as Ministry of Health officials, as well as the consulate officials over there. So we have made few suggestions like the joint working group, like rightly Virenchi Shah and Aprajita madam mentioned. We should I think look at as a good suggestion, as well as we have Pharmaceuticals has also suggested for entering for an MOU with CDSCO and DAV. For the reason any adverse reactions or anything that DAV wanted to communicate can easily communicate with CDSCO, and this can help facilitate Indian companies as well. Having the product registration approvals at the on a fast track basis. And so the DAV CDSCO also have a cell called international cell, which DAV can coordinate with and communicate with them for any kind of communications with respect to COPP authentications and other things. And this can better facilitate the industry to have those documents processed. And similarly, at the recommendation of Pharmaceuticals, DCGI has issued a letter stating that COPP is not issued by the state regulatory authorities, central regulatory authorities, and it is being issued by state regulatory authorities, which has come to the help of the industry. Definitely, the COPP uniform format is one another thing which we have taken up, and then I think DCJ is actively working on it. It is very well known that the pharma sector has been identified as a priority sector. What we can probably look at is the technology transfer in key therapeutic areas like vaccines and other critical drug formulations. And when it comes to investment in pharma manufacturing facilities, we look at Vietnam should provide the conducive environment and various incentives that would facilitate Indian companies to come to Vietnam and have that collaborations. This is what essentially I would like to say. Thank you.
Thank you so much, sir, for being short. But you have raised some very important suggestions, which were also the kind of questions that some of our pharma leaders were about to ask during the introduction. Now, with this, we conclude the second sectoral session. So if the Excellency is back, if I can request Excellency to also come in camera. Excellency, if you are there, I would request you to kindly be with us so that we can have our interaction now. So we will open the floor for discussion. And I know we have the pharma leaders who have a lot of queries and questions. So I would also request Dr. Professor Zoom's office also, if we can also be active, because now we will open, there'll be a couple of questions from Indian Pharma to our representatives from Vietnam. So with this, we open the floor for question answer. So any question, we have a lot of questions in the chat box itself. And, Excellency, if Excellency is there, I wanted Excellency's view on this speech, and then we could have. So Smita ma'am, I think she was the first one to ask questions. Smita ma'am, are you there? If you can come and ask a question, I can read out the questions that you've asked also. So she is asking, I look up to Excellency for advice. How can companies prove our credentials and build up trust? So basically, a lot of Indian companies wants to get access to Vietnam. They wants to open operations in Vietnam, get access to Vietnam.
So I would just like to say that we are already working in Vietnam. We are doing business in Vietnam. Our company has excellent credentials. We have been approved by the most stringent regulatory authorities. We have provided and always provide all the proofs for this, but still there are things, small questions which come up asking for proof. Now, for example, I explained to you that we requested the DAV to directly access the link of MHRA, which would show that our product is approved there and we have been approved by MHRA as well. However, they denied and they said that they need a letter from MHRA. Now, why would MHRA give us a letter like that when it is there on their website? So these are the type of problems that we face, which increases the approval timeline. And there is a lot of to and fro which happens. So basically my question is, when we have once proven our credentials, we would be also happy to invite the MOH of Vietnam to come and see our facilities. So once and for all, if this issue is solved, then it will quicken getting the.
So kindly be brief with the question, so that we can cover more questions. Yes. So I want to request Professor Zoom's office, if Professor Zoom is there, kindly be there and for the answers of the questions. Professor Zoom, are you there? Professor Le Viet Zoom, are you there? Yeah.
Yes, sorry, this time is Zoom is in well.
Okay.
So question, please send letter to him.
Sorry. So should we take questions?
Yes, please send question by letter. because this time Miss Dung had a meeting outside here, and he's go out some minutes ago. Yes.
So will you be able to address some questions? Will you be able to address?
Because
Can you give some answers to the questions?
I think this question maybe Miss Dung is only he can answer, Madam. Okay.
Right.
Yes.
So we will take couple of more questions. In the meantime, if you can please see Professor Zoom to join back, that will be great. So, okay, any more questions or suggestions? Because Murali sir is giving some good suggestions. He has already given. So, any more questions or suggestions or advice you have? Anyone else who would like to share something?
Good afternoon, sir. Can I speak?
Yes, sir, please.
I'm calling from Mumbai. I just wanted to whatever the gentleman has just now said. It is better that we all form a question paper, where we have these questions jotted down one by one and maybe given to them so that they can answer us, correctly. In any case, so my experience with Vietnamese on phone is there is a there is a difficult language barrier which anyways exists. So it will be better if we can write down our questions and request them, and then later on you can share with us also. That would be my
That
request
is
to you, all of
excellent
you.
idea.
Yeah.
That is an
And
excellent idea.
and secondly, let me congratulate all the Vietnamese officers and all the His Excellencies and everybody out there to do such a wonderful job on COVID. I am told to understand that my Vietnamese peers are now really enjoying normal life, going to normal places as we normally do without any issues. And I think they are exemplary as far as things go in teaching us. And we need to learn as a nation from Vietnam how they could control this pandemic. They have done wonderful. They have done wonderfully, and literally the entire the entire country is open for everybody as a common as normalcy. So I wish to congratulate them for their effort and also request them to share their good experiences with us on COVID management. Thank you.
Absolutely. Thank you so much, Farag sir. Wonderful to have your view. Any other views or opinions that anyone would like to share? Yeah.
Hi, sir.
A small intro and then you can go on. A small intro.
Yeah. Sir, I'm Jayaprakash from Mumbai. My company name is Medicure Formulation Private Limited. My question was, can third-party manufacturing companies can participate in export market who doesn't have their manufacturing facilities?
Yeah, please go on. Please go on.
Yeah. So this was my question. So can you please answer this question?
Okay. So I have noted your question. I will take this question to the embassy and we'll come back with the answer. Because
okay, sir. Thank you so much.
Any other observation or question? Viransi sir is here. Because it's very technical, so we can't have answers of all the technical questions actually on Zoom meeting. So if Professor Zoom is back, please let us know so that he can take some questions from the audience. We are also noting down the questions. We are also recording this, so we will make a list of questions we'll send to the embassy. We will get the answers and we'll get back to you. Yeah. If anyone would like to share a question, any view, please.
Sir, I have a question. This is Dhaval Talati from NIM Laboratories. Am I audible?
Yes, sir, you are very much audible.
Okay, so my question is that due to the changing regulatory scenario, everyone, including the Vietnamese DAV, are in the process of upgrading their regulatory structures. So we would like to know whether there is an outgoing regulation and there is an incoming new regulation, because that would, I'm sure, all the participants would benefit to understand if there is an obsolete kind of regime which is going out and a new one which is coming in, so that everyone can, start afresh in a way which benefits both the regulatory authority and the industry. Thank you. That's my question, please.
Thank you. Wonderful question. And this is very relevant. So, yeah, I think Mr. P. Ghosh, you wanted to say something?
Yeah, actually, sir, I am P. Ghosh from Stadmed Private Limited. Actually, we are producing the pharmaceutical products for a long time, for around 70 years. We are having the credibility in the production of good manufacturing practice. And how we can export these medicines to our Vietnam, in which way, where to contact, is there any single window through which we can contact? If we can if you can share any contact procedure.
Mr. Ghosh, you can send us an email and we can provide you all the required guidance to you, sir, and how to export and what are the registration procedures.
Exactly, sir.
It would be of help to you. That's not a problem. And once you register the products, we can also assist you financially.
Okay, sir.
Yep.
Sir, why don't you come in camera and give a little brief on this thing, because you said you can help financially also.
Yeah, I think what they can do, all the exporters, like whoever wanted to export their products to Vietnam, they can write to Pharmaceuticals. A simple email would give them the registration procedures and what are the potential products as well. As Pharmaceuticals, we always give the information on what are the products that you can export and which countries you can export. So this kind of analysis can be provided from Pharmaceuticals side. And we have also developed regulatory guidelines for about top 20 countries, which is freely accessible on the website of Pharmaceuticals. So that itself gives you where to register, how to register, what are the application form, fees, everything, the market potential, everything has been provided, sir, on our website. And see, with specific to Vietnam, yes, you can write an email to us and we'll provide you the guidance.
Thank you very much, sir. Thank you.
Wonderful. Yeah, Aparajita ma'am, if you're there, may I request you to give your comment and observation on the discussion? So I think you want to, Aparajita ma'am, are you there? If you'd like to say something. Okay, so any other questions or observations? I will say a few words. If you have any questions, I think someone asked questions. Yeah.
One more question. Sorry about it. First of all, I want to thank you especially, sir, for giving us this opportunity to interact with seniors in Vietnam. And I can't thank you enough for it. Secondly, thank you, sir. Secondly, sir, I'm told to understand that there is a booklet of legal documents which are required for registration and the policies as per the Vietnam embassy. You know what His Excellency said in his meeting, in his talk in the morning. So I just wanted to know whether such booklets are available in legal language for the benefit of all to understand the legalities in the registration, and then accordingly go ahead with the registration of companies and products in Vietnamese market. So could we also get such a copy if there is any available for benefit of all, sir?
Definitely.
Thank you, sir. Thank you so much.
And if it is available at the embassy, we'll be very happy to.
Thank you, sir. Thank you so much.
Right. So
generally, the information on the registration guidelines and the time-to-time updates is available on the Vietnam DAV website also. So that can be accessed to and see what kind of new regulations that they are coming up with. They normally issue draft circular and then they bring it to implementation. So whatever the updates they wanted, the DAV website can be visited and then they can go through those things. Thank you.
Thank you so much, sir. Thank you, sir.
Information before someone would like to share anything. is that the Drug Administration of Vietnam has issued a new drug registration where within 180 days of application can be submitted. And this process is quicker than US, UK, and other countries. And in line with many other Southeast Asian countries, I think there are two core issues that we need to address, or if Indian side can take care of, that will be nice. One is the extra documentation that you might have to submit, because they follow the European or Western standard. So that is why, no kind of compromise in terms of quality or documentation will be entertained. So that is one area, and that is why a lot of new product takes time to register in Vietnam. And the other is you have to produce also a document in the local language. So you can't just do it without any documentation in the local language. So local language sometimes has been raised as a worry or a concern for Indian or many foreign players in the sector. But as I told you, there are two things. The pharmaceutical industry in Vietnam remains moderately developed, which means it has tremendous amount of more improvement and development. This also gives a lot of scope to Indian ones, because local companies are looking for partners in different part of the world, and India has an extreme positive view on this thing, especially in the pharma sector. The second is, for the Indian players, Vietnam is again one of the most attractive places, because their labor laws are very flexible, they are very sharp, and the cost is comparatively quite low. The other important aspect is their per capita income of Vietnam is rising, and so is the aging population, and hence a huge focus on health care expenditure or spending. So this also gives a good amount of opportunities for us. But more importantly, Vietnam is a very nice route of access. It can be a very nice destination through which we can redirect our export to many other countries. So there can be some subsidies or some support uh, that we can explore Vietnam as a destination in this. So any questions or anything, any views? If you have, or Professor Zung, if you are back, I'll be very happy if Professor Zung can share some views if the meeting is over, or anyone from Zung's office, Professor Zung's office, will be great. I think they are stuck with a meeting. Murari sir, with this, I think.
Sir, are we having a panel discussion now, or we are?
No, with this, we will have the Excellency back. Excellency is
Okay.
also just stuck for an important work.
Okay. Sir, I would like to say something, add something here.
Please.
Well, Vietnam is certainly a lucrative market and, a potential market for our investment as well. If you look at the overall potential of the ASEAN region, because the region, the Vietnam as a country of ASEAN region has an advantage of exporting within if somebody sets up a plant in Vietnam, that gives them good access to the countries within ASEAN region. So certainly, if you look at the trade potential also, Vietnam stands out as the largest market with good potential. Preferably, if we have to look at investing in that country, we have to certainly look at two aspects. One is epidemiology of that country, and the second one is we have to look at what kind of incentives are being brought out in terms of the from the investment board, which can drive Indian companies to Vietnam. So, and from Pharmacil, we as an Export Promotion Council, we are always there to support, any kind of such promotion measures. And if Vietnam Investment Board can give us some the proposal or the scheme on the investments, how the investment can be made, whether there is a park in place or not, what kind of incentive is being provided, if yes, how many years. So if these details can be provided, if these details can be finalized from their end, and those can be shared, yes, we can circulate it to our member companies for their information. And interested companies can certainly look at as an opportunity to invest in Vietnam. So this is what I would like to say precisely. But yes, for currently India and Vietnam are good partners in terms of pharmaceutical trade is concerned. Uh, and the indigenization is happening in Vietnam, which can be seen, and government is promoting the local industry and manufacturing at large. So Indian pharma industry can look at cooperating in the area of bulk drugs as well, or the key therapeutic areas like oncology, wherever there is no technology. So those technology transfer also can take place in terms of joint ventures or the joint collaboration proposals. So we can work with the boards concerned, and then we can see the trade between India and Vietnam is enhanced. Thank you.
Absolutely. I think wonderful. Sir, again, my suggestion on this front, excellent actually suggestions you've shared. I think Pharmaceuticals must be doing a lot of trade shows in different countries. Like, are you taking any delegation, India Farmers delegation to Vietnam? You must be doing it.
Yes, every year we take a delegation to Vietnam. I know, in fact, Pharmaceuticals takes up delegation region-wise. So to ASEAN, CIS, LAC, Africa, all these regions we take up the delegations, and every delegation, every year we make it a point that we visit Vietnam. We have meetings with BSM, business meetings in Ho Chi Minh City. So this is a regular exercise, and we have been interacting with DAV. We have been interacting with Ministry of Health. We have been interacting with our Consulate General of India and in Ho Chi Minh City and Hanoi as well. What primarily comes out is whenever we go there, they look forward for interaction with CDSCO. The DAV, as a drug regulatory authority, they look forward for interaction with CDSCO. They also wanted to have keen, close interaction with CDSCO. So that from that, the proposal of having an MOU has evinced. So we have made certain suggestions to both the parties to see that an MOU can be signed, so that the cooperation can be fostered more actually, and we can have fast track approvals as well.
So when we go to Vietnam, I think the language issue becomes a little point there for a discussion and introspection. So if we have that solution, then I think Vietnam is a wonderful market that we can explore. So Aparajita ma'am also wants to share.
I'll tell you, business has no boundaries. If somebody thinks there's a business, then we'll carry the translator with him.
Yes. Aparajita ma'am, would you like to add anything? I think you want to share something.
Firstly, very interesting interaction. Hello, Murli. It's nice to see you.
Yeah, nice to see you.
Here only. Okay, so there are when I use the word conducive environment, I actually wanted to say this only. There have been lots of points that we've been taking up with Vietnamese FDA time and again, especially with respect to regulatory. It is the approval part wherein the time is so long, and even in renewal it's so long. And there is one thing is there that there is a rule, or there is a say law guideline, but some things have to be aligned as per logic. So those things are amiss. I heard and I discussed with the company. They were discussing they were struggling for a DMF. For example, they registered a product, and due to some reason, after 5 years, that particular plant stopped manufacturing. So they had to change the DMF. Now, changing the DMF is such a serious issue, and it takes so long that the company is not able to put relevant data. Now, if we really want everything to be dark and white and honest, then the policies also should be encouraging and systemized in a manner when there are logical issues. Those issues should be accepted by the FDA and things should be streamlined. Itna mushkil, it's such a difficult task that people are scared for such kind of things. You understand my point? So DMF part, nobody will want to, you know, or either the product will be stopped or they will not disclose, very frank. So this is not fair.
Right.
So this is all.
Right.
That conducive environment is very important.
So our Excellency is back. And Professor Zung, if you can hear us, I'll be very happy to have you also. We have noted all the questions. Any question that anyone has, please, you're most welcome to ask. I would request Excellency to share a few comments or observation in the discussion till now. And then we can also formally.
Well, thank you very much for all the questions and all the inquiries. I think that we can group the questions into three groups. The first group in terms of trade, the second one in terms of investment, and the third one in terms of policy. When it comes to trade, there is a question whether a trading company can do the trade of pharmaceutical products. I understand in our system there's no restriction which prevent a trading company from trading a pharmaceutical product, like in India. In India, sometime I was involved in the agabati, and some say that only the company who produce agabati can export and they can do the trade. In our system, I believe that we have the representative of trade here. We have Mr. Thung, who is our trade counselor. We also have Mr. Khang, who is the trade officer. They are their contact point for this. So in terms of trade, I don't see any issue at all. And of course, when you want to trade with Vietnam, you have you need to have a partner in Vietnam who purchased your product, and that partner, Vietnamese partner, will explain to you all the policy of Vietnam in terms of restrictions, conditions for trading in pharmaceutical product. You know that pharmaceutical product is a sensitive product. It relates to the safety, human safety, life and death of a person. So we have to follow very closely. And it's not only in Vietnam, it's everywhere. So that is the first thing in terms of trade. The second thing is in terms of investment. There's a question about whether is any incentive in terms of investment. I think that in terms of investment, if anyone, if any company who is serious in investing in Vietnam, I would like to talk with them and guide them through this process. In the past, we have been able to guide HCL, a huge high-tech company, to invest in Vietnam, and they decided to invest $650 million US. So basically, when investment, we will be there to help you with the condition that you also need to do your own homework to make the market research. And now if you need any additional input or touches in terms of incentive, in terms of tax, in terms of land rental, things like that, we are there to help you. The third group of issues concerning policy, regulations, things like that, I believe that this has been published in English in the portal of the Ministry of Public Health or the Drug Administration Department. So you just follow there very closely and everything is there. Now, the last person talked about fairness and the transparency. I want to share with you very frankly one picture. Long back, Vietnam was the French colony 75 years ago. So we are very much influenced by French culture. In the same way, India is influenced by British culture. And France has one of the biggest access, namely pharmaceutical. French pharmaceutical products are popular and famous. So we are very fond of French pharmaceutical products, and that comes from generation to generation. So it's very difficult for us to open to other product. Then later that we are a little bit more open to European countries products, and then American. For Indian pharmaceutical products, number one, we don't have we have not familiar with that product, although we know that India is the third biggest country which produce the third biggest producers of product, but still, and so it takes time for us to be able, for our consumers to be able to consume Indian products, pharmaceutical products. That's number one. Number two, recently we have opened our market, and as I stated in my opening remarks, there are some company which export to Vietnam low quality product, and that has destroyed the image of Indian pharmaceutical products, and more than 50 Indian made products have been placed in the blacklist for ban of import into Vietnam. So that again add to the hesitation that the Vietnamese people normally have vis-a-vis Indian pharmaceutical product. Now the government of Vietnam has made a huge effort, of course, at the request of the Indian government, and the Embassy of Vietnam here have been very supportive in making that change possible. Namely, before we place Indian company as the category 2, now we place Indian company in category 1, provided that Indian pharmaceutical company can have a license that certify that their product as good as European pharmaceutical product. Now we also open to the next step in moving India from group 3 to group 2, which allowed India to participate in the public procurement for public hospitals and healthcare facilities. So this is also a huge stride in raising the trust of by the Vietnamese customers on Indian product. So I think that it takes time, and now if we move strongly, then we are ready to go ahead with you to accompany you in this process. I'm very thankful for to Vietnam. That is very positive, and I think that if any company who is interested in Vietnamese market can contact him, because he understands very well the Vietnamese market, and I think that that is the first point for you to contact with. At the Embassy of Vietnam here, we have the trade section headed by Mr. Thương. You can have his contact when you want to have more inquiry in terms of trade in pharmaceutical. We also have economic section, which is taking care of investment. If you really want to invest in Vietnam, then you are most welcome. There are potential policy by the Vietnamese government to create, as Professor Dũng mentioned earlier in his statement, the 2 pharmaceutical hubs, one in Quảng Ninh and the other in the metropolitan city of Ho Chi Minh City. And in that hub, we want to regroup all the major pharmaceutical producers of India in Vietnam, and we will join with them, with the local pharmaceutical companies, in order to have a joint venture produced in Vietnam, and subsequently you can export to other countries. At the moment, Vietnam has 14 free trade agreements with the European Union, with Japan, Korea, with Russia, with many partners. The Vietnamese economy is very open, 200% open, and the most populous open trade policy in the world. So you can have the opportunity to establish your production base in Vietnam, and then work with the local partner in order to export that. So Mr. Akram, basically those are my remarks, and I hope that may help you to understand a little bit about the pharmaceutical sector in Vietnam, which is a very, very sensitive, and it's also very technical. Thank you very much.
Thank you so much, Excellency. You have very nicely and clearly pointed out, and which also, I think, help our Indian entrepreneurs or pharma leaders to understand that pharma is a little sensitive sector to deal with and a lot of technical stuff. So you know it more than me, and hence it needs much more discussion and uh, personal contact to deal with. And I think the embassy is here. The embassy can provide all necessary support that you need. So if any one of you would be interested or would like to meet Excellency or the officials at the embassy, you can directly reach out to the embassy. The embassy has now the official website where you can reach out to them. You can also reach out to me if you want to meet to Excellency in the office, so we can also mediate and arrange any discussion that you would like to have. So now with this, any more view or observation that anyone would like to share? With this, then we can formally close today's discussion.